मिसिंग टीथ, व्हाट हैपेंस इफ यू डोंट रिप्लेस देम? हम हमेशा सोचते हैं देयर आर 32 टीथ, 32 दांत हैं हमारे पास, यदि एक दो चले भी गए तो होगा क्या? And it's a very common complaint and ignorant behavior from the patient in the OPD. सर मुझे इस साइड से कोई तकलीफ नहीं है. When I check into the mouth, there are no teeth at all, but they are happily chewing from the other side. When I take the history, तो यहाँ के दांत सर 10 साल पहले या 15 साल पहले निकाले थे, लेकिन अब ठीक है, दर्द होता नहीं है, दूसरी साइड से मैं चबा रहा हूँ या चबा रहा हूँ. But this is not the healthy lifestyle to take forever. Many people assume टूथ लॉस इज जस्ट अ कॉस्मेटिक इशू. यदि एक दांत चला भी गया तो हो क्या जाएगा? इफ आई टेल यू a single tooth loss can affect your entire body sooner or later, so you will be surprised, right? But yes, it's a truth. A single missing tooth, yes, can disbalance your body in a very minimal way that you might not even know about it. Scientific data that approves how a missing tooth can affect the body in a holistic way. So, according to the Journal of Rehabilitation, it states that the missing tooth can affect the jawbone health, digestion, speech, and even the lifespan of the patient. According to study published in Journal of Oral Rehabilitation Europe, it has stated there are higher risk of cognitive dementia and a lesser lifespan in people who lose their teeth in the early age as compared to the people who have a good oral health and they maintain it for a longer time. So yes, they have a good lifestyle as well as a longer lifespan as compared to the individual who are not maintaining the oral health. Now we will talk about the consequences of missing a single tooth, not multiple, just a single tooth, how a body reacts. If suppose you have a tooth in a single row, so you must know teeth are just like the books keeping on a bookshelf. If you remove one book, all other books will fall upon each other. This is how the teeth behave. When we remove one single tooth, so automatically you start chewing from the other side, because to reinforce the mastication, a maximal number of teeth or optimal number of teeth to produce that masticatory load for a proper chewing is not present in that side from where the tooth has been extracted, and the other side as well. So automatically you shift your chewing to the another side. So it lead to the misalignment of the bite. Misalignment in a sense कि you are tend to chew from one side and another side you are not using. You must know this particular bone, which is called as the mandible, is a horseshoe shaped bone, and it is connected on the both side with the help of the joints called as temporomandibular joint, and this whole bone is one. If you keep on pressuring on one side, so yes, there will be a misalignment and bite issues in a longer run. The area from where single tooth has been extracted, so teeth adjacent, it means the front one and the back one, they'll start shifting to the area where will they find the space. As I mentioned earlier, tooth are just in a symmetry and in a completely packed form. They need tight contact to be in harmony and equilibrium in the physiology of mouth. And if you remove one, automatically the back tooth shift in that region. And we all know to chew the food properly, we need a proper contact between upper and lower tooth. If this kind of contact is not there, the chewing is not very comfortable. Because of the shifting of tooth, now the upper tooth and lower teeth are not touching each other at the maximum intercuspation area. Maximum intercuspation means it provides a better chewing. So better chewing experience cannot be possible when there are number of teeth less what they are needed. According to the American Journal of Orthodontics and Dentofacial Orthopedic, after missing a single tooth, adjacent tooth shifts significantly in that direction, and it maximize the complication of orthodontics in a coming time. So early loss of tooth in the earlier age always prone for the orthodontic corrections in the future, followed by the implant replacement for the rehabilitation. So we will talk about the anatomy of a tooth and a surrounding bone. You must know every tooth is comprised of two structures. The upper part of the tooth, which is seen in your mouth, which is visible outside, it is called as a crown. And the crown is supported by the portion which is embedded inside the bone, which is called as root. So grossly, tooth is divided into two parts. Upper body is called as crown and lower body is called as roots, but it is whole, it's a single piece, and tooth is supported inside the jaw with the help of a periodontal fibers which are coming from the bone as well as from the gums. So when you remove the tooth from that area, so automatically bone resorption in that area happens. So the tooth, suppose it was at this level and we have removed the tooth, so earlier bone which was present here, automatically the bone drops in that area. So after years, when you want to go for the replacement of the same tooth, the doctor will advise you for the bone graft followed by the implant. But if you remove the tooth and go for the implant at the same time, so it will prevent the use of bone graft for that implant surgery to provide a sustainable support for the upcoming processes and bone. Jawbone relies on the stimulation. If the stimulation is good from the teeth, chewing, health and a proper hygiene, then only the jaw supporting the teeth are in a healthy condition and they can provide you the maximum efficiency of chewing. And once we remove the tooth, the density of the bone changes. Bone is grossly made up of two kinds of bone. So I'll call this hard bone and soft bone. So the upper part of the bone where the tooth holds, it is called as cortical bone. Inside again is a cancellous or soft bone, and the lower this particular area, basal bone, is a very hard bone. So mostly the tooth occupies the region of upper hard bone in the form of cortical bone, and the mid mushy part is called as the cancellous bone. Once we remove the tooth, the cortical bone automatically, the hard bone automatically resolves, and you are just left with the cancellous portion of bone with the some cortical bone. So hard bone content become less, soft bone content become more once you remove the tooth from that area. It has been noticed after the removal of teeth, just within a year, 25% of bone density along with the volume of the bone loses. Now we will talk about how the facial structure changes after the tooth loss. And we are not noticing it very quickly, but certainly is changing the facial profile. So first example, if I remove your front tooth, so automatically the lip support, this lip support will become saggy. World is crazy about the pouts and the lip pouting, but you must know the lip support is mostly because from the underlying teeth. Any kind of filler, any kind of lip enhancement surgery will be failed if there is no good support from the underlying bone as well as tooth. So facial structure and the lip support is very much important part of the facial aesthetic. Few other issues like premature aging, sunken cheeks. What are sunken cheeks? If anybody has lose their teeth in the age of mid 30s or 40s, for the rest of the life the cheek will be sunken like this, and you will only see this prominent portion of the face which are called as zygoma. So it is very vivid from the front. If person do not have any teeth in the mouth, automatically the facial muscles collapse and the cheeks sunk in. So this appearance is only because of the loss of teeth, not because of the aging. Loss of teeth can make you old in the age of 40. Likewise, a 80-year-old person would feel. So yes, sunken cheeks and premature aging are the very much important effects of the loss of teeth in an early age. You must have noticed many wrinkles on our parents' face in the form of wrinkles in this corner of the lips, upper lip area, slightly here. These are the signs of aging. But yes, teeth and bone support is one of the prominent factor which can affect in the positive form or as well as in the negative form for the aging. If patient do not have teeth in the frontal region or as well as in the back region, so automatically the bite collapses. So what is bite collapse now? If suppose this is your lower tooth and this one is your upper teeth and they are touching each other in exactly in this position, so there is a height from here to here, which is giving a facial height. If suppose the frontal cusp or the upper part of the teeth is completely being chopped off, so automatically this height will get reduced. So this is how the facial collapse happen. So people who are in 20s or 30s, they are smile like this. It's always a U. But people who are in 40s, 50s, not maintaining well, teeth are untreated or loss of teeth, always have a smile like flat and like this. So these kind of aging effects only happen because of loss of teeth in early age. According to International Journal of Periodontology, people who lose their all teeth, so there are data which suggests approximately 4 millimeter of bone loss is there in just the first year after the teeth loss. Now we will talk about how the articulation of speech and how the speech can significantly affect with the help of teeth or without the teeth. As we all know, for any kind of language to communicate well, we need some kinds of words in the form of vowel or consonants. हम हिंदी में बोलते हैं स्वर या फिर व्यंजन. So when we speak, most of the consonants we use along with the vowel. So vowel like A, E, I, O, U. When you speak such vowel, there are no much of lip touching each other, so they are not affected. But the words which involve the touch of lips while speaking, they greatly affect when there are no teeth at all. So that's why many people struggle for the pronunciation of S, CH, SH if they do not have any teeth. Because of inability to chew, many people suffers from the problem of digestion. So what are digestion problems? If you are not chewing your food well in the mouth, so many of the enzymes which are responsible for the digestion of food are not there. So stomach is under prepared for that hardly digested food to push into the next system of the digestion cycle. So yes, India is one of the capital country for the diabetes, now for the digestion issues as well, because of the gross neglect of the oral hygiene for a long time. If your chewing process become inefficient, so what will happen? So according to the data provided by NHS and all, it has been stated everywhere, if people are taking less fibrous food, less vegetable, so it significantly risk their digestion health and overall health. According to British Dental Journal Health, it has been stated people who are consuming less vegetables and fibrous foods, they are at the risk of developing malnutrition sooner as compared to the other people who are following a healthy lifestyle. Missing teeth and not maintaining oral hygiene up to the mark can lead to heart disease, diabetes, and the cognitive decline and Alzheimer's disease. According to Harvard Medical School study, people who have less than 10 natural teeth, they have 40% higher propensity for dementia and other cognitive related diseases as compared to the patient who have full set of dentition. Before jumping on to the conclusion, treatment options and what kind of treatments can be done, what options are needed, I'll just tell the small thing. It all starts from a single day where a small black spot arrives on the top surface of tooth, and it gives you a gentle reminder, yes, I am deceased, please get me corrected. If you can notice that small black dot on very first few days, yes, none of the treatment would ever be needed to treat you further in life. So we will discuss about the treatment options, about the missing tooth or a loss of teeth. So I'll divide this missing tooth agenda into the two parts. If people who are there with single, double or few missing teeth, they will have a different treatment plan. And people who have a complete set of teeth which is missing since years, this definitely they will have a different treatment plan. So first we will talk about the people who have single or double or few teeth which have been missing for a long time. So I will advise them, any kind of tooth, if it has to be extracted, that need to be replaced immediately. As I have mentioned earlier, once you remove the tooth, the bone supporting that particular tooth won't be there for a long time. So again, you have to compromise on the replacement, along with the feel of chewing won't be there if your bone support is not proper for the lifetime. Treatment options can be divided in the form of temporaries or in the form of the permanent one. Temporary, why I'm saying temporary? Because in this digital world, we are looking for the more sustainable connection who can serve you well for next 20, 30 years. So in earlier times, when advancement and technology and even the knowledge and the skills was not up to the mark, so the old options for a tooth replacement was cast partial dentures or the bridges. So these are the good options yet, but yes, they will come with certain limitations and maintenance. In earlier days, people used to go for partial dentures. Partial denture means 2 या 3 दांत यदि मिसिंग है तो बाजू के दांत का सपोर्ट लेके वहाँ पे एक पार्शियल डेंचर बनाया जाता था, विच इज रिमूवेबल, कि जब हमारे खाना खाना है तो वो डेंचर लगा लिया और रात को सोते समय निकाल दिया. बट रिट्रीवेबिलिटी इज अ कॉम्प्रोमाइज फॉर अ गुड लाइफ स्टाइल. हाउ? बिकॉज इफ यू आर इन अ party or anything and your denture pops out, that's not a very good thing. And denture are supposed to last for few years, because as I mentioned earlier, any kind of bone only works when there is a stimulation only happens with the help of teeth. Dentures take the support from the overlying mucosa, the soft tissue. It is not providing any stimulation on the underlying bone. That's why when we use denture after 3 to 4 years or 5 years, it gets loosened. So yes, you need to replace your denture again after 4-5 years. Dentures are not a long-term solution for long time. Now we will talk about the most favorite options. Sir, मुझे implant तो नहीं करना है और denture मुझे जमेगा नहीं, तो can we go for the bridge? So here I'll state a very one standard law that is called as Ente's law. What the Ente's law states? Ente's law is something, area which supposed to be replaced always get abutment area or support from the area which is double the area which is to be replaced. Getting my point? यदि आपका एक दांत मिसिंग है तो कम से कम उसे 2 दांतों का सपोर्ट चाहिए. यदि आपके 2 दांत मिसिंग है तो कम से कम उसे 4 दांतों का सपोर्ट चाहिए. दिस इज हाउ द फिक्स पार्शियल डेंचर वर्क्स. बट व्हाट हैपेंस इन मोस्ट ऑफ द टाइम, people are there for missing teeth like 4-5 and they want to get a replacement from a front tooth and a back tooth. That won't work. That cannot possible. As I mentioned earlier, hardly 2 or 3 teeth can be replaced with the help of a bridge, not a 6-7 teeth, because your arch shape is like this. There is a curve, so all the forces which are going through the teeth, they are vertical. If you make a trajectory which is not favoring the vertical trajectory of force and occlusion, so automatically the teeth which have been supported for the bridge fixation will pop out. It happens after many years. जिस दांतों पे ब्रिज लगाया था वो दांत भी ढीले हो चुके हैं और वो दांत बाहर भी आ चुके हैं. नाउ द गोल्ड स्टैंडर्ड फॉर द रिप्लेसमेंट ऑफ अ मिसिंग टूथ, यस, it is dental implant. When we go for a dental implant, as I mentioned earlier, bone takes support with the help of stimulation if teeth is there. So according to the book as well, implant is in replacement of a missing tooth. When an implant goes inside the bone, it activates the bone in that area, so no further bone loss will be there. So what are the advantages of dental implant? It prevents bone loss, lasting lifetime, and have a chewing efficiency just like your natural tooth. Now we will discuss who are the candidates for dental implants. Dental implants की ज़रूरत किन्हें है? So most common question I get in OPD, will it hurt? Am I too old for dental implant? Am I too young for dental implant? So you must know there is no age related bar in adult dentistry. I am mentioning it again. adult dentistry for dental implants. So yes, kids are not the patients for dental implants, but 18 onwards, yes, you can have dental implants if there is a missing tooth or a grossly decayed tooth. Next very common question is, sir, I have a diabetes, can I have dental implants? And in this diabetes, how will I manage with the implant? So you must know, diabetes is not a disease. Diabetes is a condition. Diabetes is just like, it's a special path and you need to walk on the same path. If you deviate from the path, yes, your life will become troublesome. So yes, in diabetic patient, you need to maintain a blood sugar level with the help of medication, maybe in the form of insulin, and a regular checkup on periodic time interval. So for the diabetic patients, implants are different. Why? Because the bone integration differs in diabetic patients. I'm giving you an example. If I compare between a non-diabetic person and a diabetic person, if I remove a tooth from a non-diabetic person, it will take around 3 to 4 days for a discomfort and healing. But in a diabetic patient, it might double, it might triple. That's why the implant option, grafting options, and many other things includes in a diabetic person treatment. But yes, they can chew the food normally as like at any non-diabetic person. In the diabetic patient, you must know, for performing any kind of surgery, doctor will first ask you go for the HbA1c report. It is glycosylated hemoglobin values. So these values must be between 6.5 to 8.5 for a successful surgery. If your values are more than 8.5, it's better you should wait and recalibrate your lifestyle along with the food, diet and tablets, and come again after 6 months. So yes, you can have a dental implant successfully. According to the Journal of Oral Implantology published by USA, it has been stated, people who are maintaining diabetes well, there are 90% success rate of dental implant as to the congeners of non-diabetic people. Missing teeth is just not an aesthetic issue, it's an emotional issue. I'll give you a simple example. If a young boy or young girl has a tooth missing in the front, they'll always shy to speak, they'll always shy to meet new people, they'll always smile like this, and somewhere they will always stand in the back row because they don't want to be seen in the front of camera, or any kind of leadership abilities won't be there until he or she has a good smile and a perfect teeth. So yes, dental pain or missing dental tooth is just not a aesthetic issue, it's an emotional issue. Most of the patients in the age of 60s, 70s or 80s, once they lose tooth, they think अभी जीना ही कितना है, अभी मेरे साल ही कितने बाकी रह गए, मैं खर्चा करके करूँगा ही क्या. So I want to tell each and every geriatric patient plus 60, you really don't know किसका टाइम कब आने वाला है. But yes, everyone deserves to chew the food well. Everyone deserves कि स्वाद क्या होता है. Everyone deserves what kind of cuisine you want to have. So any kind of digestion issue or gastric issues, mainly because of the non-functional teeth, or if you do not have any teeth. If you just put a simple denture or in the form of implant supported dentition, half of the gastric issue, half of the digestion issue will be off on the very next day. In the end, I would say, जो मैं हमेशा कहता हूँ, dentistry is not expensive, neglect is. So just keep up with your dentist and take care of your oral hygiene. Be happy. Thank you very much.